We are here at my friend Kristen's house, who is also my campaign manager because my Wi-Fi is not working. But we are being very diligent in practicing some good social distancing and Lysoling everything. So I hope everybody is doing well and doing all they can to help prevent the spread of coronavirus. And I will wait just a few moments here to let everybody join.
Maybe you want to introduce yourself, Celeste?
Yeah. So while we're waiting, I'll go ahead and introduce myself. And you will hear Kristen asking me questions as we go. So I'm Celeste Williams, and I am a family nurse practitioner who is running for U.S. Congress here in Arkansas's 3rd Congressional District. And I am running because each day I see people who are struggling with the cost of health care, and I want to make sure that everyone can get the care that they need and not go broke. I think we have to have a world-class education system, and we need to make sure that workers are paid a fair wage. Let's get started with questions. And as we go, if you would like to submit a question, please do so. You can send a question in the messages. There is a little bit of a time delay, but we'll get to it as we can.
In the comments would be great.
Yep. Questions in the comments.
Perfect. We had a couple of questions come in advance, and let's start with those. Celeste, from Bobby in Russellville, will you be bringing up Womac's awful votes to cut Social Security, Medicare, and Medicaid?
Absolutely. That is a very important thing to bring up. And to be quite honest, a lot of the reason that I'm even running is because Steve Womack voted 54 times to repeal the Affordable Care Act without a replacement. And I think that that is wrong. I think we need to be moving in a direction to get more people the health care that they need rather than making it harder for individuals and families to get the care that they need. And we also need to make sure that we are protecting Social Security. He has recently come out and continued to support the proposed budget from the White House that cuts Social Security. And in addition, it also continues to recommend a 15% cut in funding to the CDC. And I think at this point, we can all understand why it is so important to invest in a strong public health system.
Will you be campaigning in Russellville?
I will, and I have. I've been to several events there already. Certainly right now, with really encouraging everyone to do their part to help prevent the spread of the COVID-19 virus. It does change the way that we campaign, but we've had several meet and greets there. We have been to several community events and a lot of outreach and engagement with the Young Democrats at Arkansas Tech, as well as working with the Polk County Democrats. And so we will continue to do those things, and really at this point we need to be more out in the community, meeting new people who may be undecided as to how they will vote in this election. But please invite your friends to follow us on social media and subscribe to our newsletter, and that way you can help share and get the word out.
Celeste, speaking of being out in the community, not everyone knows that you're still working currently as a family nurse practitioner. Can you speak right now to what you're seeing and experiencing, and yourself personally, as well as other people in the healthcare community?
Yes. So, I have worked in healthcare for over 20 years now, and I have never in my lifetime seen such rapid change in the way that we do things. For primary care, we are certainly moving to more telemedicine, phone call visits, video visits, e-visits, And, for where I work, and I certainly do not want to speak on behalf of my employer at all, but our goal is to try to get to about 90% visits being done outside of the clinic so that we can reduce the number of people who are potentially exposed to other sick people that may have the COVID-19 virus. So my husband is also an ER nurse, and I was really concerned over the weekend when he got the last mask that was in his size in the hospital. I am hopeful that supplies came in on Monday and that people had the means of protecting themselves. But when you have states bidding against one another and also bidding against other governments, like Italy, Japan, China, all these people are bidding against one another to procure personal protective equipment so that nurses and doctors and anybody in the hospital don't get sick. And I think if ever there was a time for the federal government to step in and do their part, it is now. We still don't have the number of tests that we need. We need to make sure that we have equipment for nurses and doctors. We need to know the number of beds that we have in communities and how many people each hospital serves so that we can estimate how many people are going to potentially be infected and then continue that projection out to see how many people will probably require hospitalization and ICU beds and ventilators and oxygen and all of those kind of things, and making sure that we have staff available. At this point, I know one of the local hospitals had estimated that they will be seeing at peak over 200 patients admitted a day. We obviously do not have the staff available if we have nurses and doctors who are getting sick. Right now, we need to be planning for contingency plans when that happens. We need to be making sure that we have field hospitals set up right now. It is a basic math problem of looking at what percentage we think people are going to become infected and making sure that we are as prepared as humanly possible.
What can we do to prevent shortages in rural hospitals?
So wherever you live right now, the thing that you need to be doing, because we don't have testing available where we could test and trace every single contact that person has had within the preceding 2 weeks, we need to stay at home. It doesn't matter if you are sick or not. There are certainly a number of people who will be infected with this virus and have minimal symptoms, not realize that they're sick, and spread the virus to others. And so the most important thing that we can do right now is stay at home and prevent the spread of this illness so that we can do as much as humanly possible to not overwhelm the staff in healthcare facilities. If you have a fever, you should just assume that you have the coronavirus, and there's not medicine that you take to make it better. You stay at home and you protect the other people in your community. And so the reason that you would need additional care is if you are having trouble breathing, then you need to go get additional care. That's when you go to the hospital. Right now, you stay at home.
Is there anything else that we as a community can do? That's a question we just received.
Besides
follow the guidelines?
Aside from following the guidelines, I think it is imperative right now that we reach out to our elected officials and encourage them to step in to mandate that people do not venture out in the community. They need to stay home. They need to not risk getting out and getting someone else sick. So that is one thing. I also think that we need to encourage our federally elected officials to intervene, to make sure that we are having enough protective equipment for nurses and doctors in the hospitals, and we need to have a contingency plan for what do we do when those hospitals are full, when those nurses and doctors are not physically capable of caring for any additional patients in that facility. Where are we going to take those people? Who's going to staff those field hospitals? We need to be making these plans now.
Yeah. Celeste, how important would you say it is to have a consistent message coming from our elected officials as well as from people in the public health sector and medical professionals?
I think that is incredibly important. I think that we must have reliable, consistent information on the disease. I know that it is sometimes unsettling when what we know changes daily. The guidelines from the CDC change frequently, and the reason is because this is a novel virus. This is something new, and so we are learning more about it. And so as we learn more, those things change. But we have to have calm and steady leadership from the top down so that people know what they're facing, so that we can make plans and adjust accordingly so that we can all do the best that we can to get through this together.
Based on information you've received, how realistic is it that we'd be able to have, for example, as President Trump talked about, Easter being a reasonable timeline?
No, I don't think that that's reasonable. I think that I understand that we will probably all be facing some financial pain during this basically shutdown. And if we really stay home and do our part to help flatten the curve, then hopefully this lasts a less long period of time. And the quicker we stay home, the quicker we can get back to our regular life. And, this is going to change us. There isn't going to be a return to normal. There will be a new normal.
We keep getting questions via text as well. Celeste, someone texted in saying they personally went through the testing process, and how can we address lack of communication and redundancy in screening process set up by ADH at UAMS?
So I can't speak to one facility specifically. I will just say I know that it is frustrating. It is frustrating for people who are frightened and want to get the test. But the reality is we don't have enough tests to do community-wide testing. And so the criteria for who gets tested is still limited. Go ahead.
No, go ahead.
So, I would ask, if you have a fever, assume that you have the coronavirus and you need to stay home unless you're having worsening symptoms that make it necessary for you to get additional care that you cannot get at home. And I think that this is going to take a tremendous amount of grace for us to get through this together. And I promise you that those who are doing the screening and ordering the tests are doing the absolute best that they can with what they have right now. And we all want to make sure that everybody gets the care that they need. But the reality is we have a limited number of tests. And if we don't stay home, we're going to have a limited number of resources to care for sick patients.
Celeste, we had a question from the comments from a mental health counselor. We need federal mental health parity. Can you speak to that?
I completely agree. And in all honesty, I'm not positive if some of the loosened regulations for e-visits and such applied to mental health. I think that it absolutely should. Especially right now when people are being isolated at home. And, I think about the effects of sort of diseases of despair, anxiety, depression, feelings of isolation. And, you know, just as an aside, not a policy statement, I think we can all reach out to people that we know and check in on our friends and family members and our neighbors. You know, a telephone call just to make sure that someone's okay goes a long way in helping people feel less alone.
On that line, we had a question. Some local insurance plans are not paying for mental health care services provided via telehealth. How can we address that?
I think that that is absolutely wrong. And if it wasn't addressed in loosening these restrictions, then we need federal legislation that allows it.
A couple of other submitted questions. Trevor from Harrison, if you were a legislator right now, would you pass a stimulus package to put cash directly into Arkansans' hands?
Absolutely.
And after the dust settles, would you work to pass a universal basic income?
So I think that we absolutely need that right now. Whether or not that needs to continue moving forward, I will be completely honest and say I'm a little on the fence. I think that every human being wants to have, maybe every human being may be a little bit of an overstatement, but the majority of people want to make sure that they have an opportunity to succeed and to be self-reliant. I think that people want opportunities for healthcare, educational opportunities, job opportunities, but I do think that it is a really good thing to explore and think about when we think of the automation that is happening in our world and making sure that people have job opportunities. And so, you know, I think that I would much rather give a stimulus to everyday working people versus large corporations.
Ian in Rogers asks, have you ever received money from a corporation, corporate PAC, super PAC, or other corporate affiliated entity? Have you or will you pledge to never accept one of the previously mentioned? Will you fight to end political corruption?
So I'll take those in pieces. No, I have not taken any corporate PAC money. I pledge not to take any PAC money. That is the plan moving forward, corporate PAC money. If it is a grassroots funded PAC, then we're okay with that. And absolutely, I think that we need to end dark money in politics.
Would you support Bernie Sanders' Medicare for All bill, even if he's not elected president?
So I absolutely believe that every human being must have access to health care regardless of their ability or their financial standing. So I do have some concerns with the Medicare for All bill as it currently is. We're moving in a direction where we have a huge increase in unemployment because of the current pandemic. And we have an estimate of about 3.2 million people who are employed in the private health industry. And I do not want to, in a willy-nilly, overnight way, put them out of work. And so I think that it is very important to have a public option right now. And if someone does not have health insurance, they must automatically be enrolled. And then you can opt out if you do not want to have that insurance, or you have, let me rephrase that. If you have your own private insurance, then yes, you could opt out of that. But I think we absolutely need to transition towards a system where everybody has Medicare or public option, whatever you want to call it.
Celeste, the Senate and White House, it's been reported, have agreed to a stimulus package or coronavirus relief package. You talked a little bit about direct income to Arkansans. Do you have other? What about the other aspects of that bill, and what do you think about it?
So I'm going to I made some little notes here. So I will add what has been agreed upon thus far. The government will send direct payments to taxpayers, $1,200 in direct payments for individuals with incomes up to $75,000 per year before starting the phase out. And for those earning over $99,000, families would receive an additional $500 per child. Unemployment benefits will grow substantially. Expansion of unemployment benefits, and this was broadened to include freelancers, furloughed employees, and gig workers such as Uber drivers. Small businesses will also receive emergency loans if they keep their workers, and distressed companies can receive government bailouts, but there are strings attached to that, and so that will include airlines and hotels, but they have to meet certain conditions to receive that money. So we can post this, a link of what is covered in this package in the comments below when this is over, and that would probably be a good resource for people.
What about enrolling, someone wants to know about enrolling newborn babies into Medicare?
Absolutely. I think that we need to have automatic enrollment of newborns into Medicare or a public option, and the only reason that there would be an exception for that is if they had private health insurance that they wanted right now.
Well, that's all I think that about wraps up our town hall for today. Most of our questions really were about the pandemic and the situation that we're going through. Do you have some just closing statements, or is there hope and optimism for for us as a community? I think people would like some encouragement.
I will do my best to give you some hope. So I was talking to a good friend of mine who is also a nurse the other day, and I think that it is somewhat ironic that 2020 is the year of the nurse, and it is also a year in which we are all going through a pandemic together. And I think of all the amazing work that nurses and doctors do every day. And I think that in this time we can all lean in and come together to do as much as we can together to prevent the spread of this virus and shorten the length of this pandemic. I also think that it is a time that a lot of us who have our small children at home can really appreciate the work that school teachers do when we're trying to keep our kids on task and have them do their homework at home. And I think about a children's book that I read to my son often, in which it talks about with every problem, inside of it lies an opportunity. And I think that right now is a time that we can hopefully cross the really bitter partisan divides and come together to work to make a society that is more just and equitable, where everyone can succeed, where everyone has an opportunity. So I guess that's my optimism.
Well, thank you so much, Celeste, for doing this and updating our community with this very important information and answering questions. And we will sign off and stay tuned for the next virtual town hall. We'll keep doing these.
All right. Thank you all. Be safe. Wash your hands. And I like jazz hands instead of elbow bumps. Social distancing. Take care and check on your friends and families.